If you've ever wondered if there's simple, inexpensive, old veterinary treatments that have sort of been pushed aside by modern medicine that still really work, well, great question to ask because there are a bunch of them. Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets. Today I'm going to show you 7 of those. These are ones which have been used in veterinary practice even before my time, gasp, a long time ago, but they were important, they were effective, and these are things that you can be using to help your pets now. Like your cat who might have hairballs. Number 1, the forgotten anti-inflammatory. This is DMSO or dimethyl sulfoxide. It's found in garlic and onion. It was first really discovered and used in Russia and seemed to be a really effective topical anti-inflammatory for pain, inflammation, even for our cats that have feline urinary tract disease. Say your pet has some localized arthritis on their wrist. You don't necessarily need to use an oral anti-inflammatory to help them. You can use something topical. Get yourself this inexpensive bottle of DMSO, cost me all about $10. Very cost effective, limited to no side effects. You're just putting on somewhere between 1 to 5 drops, just enough so that you can use your finger and spread it over top of the affected area. You can be doing that twice a day. Because one of the big things about DMSO, it rapidly penetrates in through the skin, getting into the affected area. For cats that had recurring urinary tract disease, DMSOs was heavily used in the 70s and 1980s. Yes, even in veterinary medicine. You don't even hear about it now. They even got to the point where they actually would inject it. But I don't encourage you to inject your cat with anything. A topical way to use it, just putting over top of your cat's lower abdomen. It's going to penetrate in through his body, eventually make its way to his bladder, and or put a small amount on the inside of your cat's ear. You do that twice a day, 2 to 3 drops, rapidly gets absorbed in the inside of the ear tip. Then it'll make its way into the bladder, helping decrease bladder inflammation. Or a dog that constantly licks an area on his leg. There's a thing called lick granuloma. They just constantly lick the fur off. You have this red open wound. DMSO has been successfully used to treat these lick granulomas. Number 2, coming from the castor bean, we have this. Castor oil. The active ingredient is called ricinoleic acid, and it is a very potent anti-inflammatory, very potent painkiller. Say your dog has a swollen knee. So you could put some castor oil on your finger. You're not going to absorb very much of it. It's a really thick, viscous liquid. Get that onto your finger and then rub it on the inside of your dog's knee. You can do that safely twice a day. A certain amount of that castor oil, especially the ricinoleic acid, is going to get absorbed, helping decrease knee inflammation. Castor oil, it's successfully being used for hairballs in our cats. It does a great job of entering the intestinal tract. It doesn't get absorbed. It can help lubricate some of that intestinal tract, pushing that hairball out. A dose of 1/4 to 1/2 teaspoon per 10 pounds of body weight daily. Castor oil, it also makes a great treatment if our cats have ear mites. So what you can do is putting in 1 to 3 drops in your cat's affected ear. You're going to be doing that twice a day. You rub the base of the ear really well to work its way down the ear canal. Do that twice a day for 7 days on, 7 days off, another 7 days on. Number 3, I'm reaching into the kitchen. White sugar. I suspect you've been taught that nothing good can come from white sugar. It's not completely true. Makes things sweet. The amount of sweet things I really like. But it also offers medicinal qualities. And I was so surprised to see it in veterinary practice. See sort of one of my first mentors in veterinary practice have a dog that had a non-healing wound. So he'd been in a car accident and he had this sloughing injury. So a whole section of the skin had been torn off. And there's this big red area of tissue that need to fill in. We need to have skin to eventually grow over there. And the way he got that to heal was using this sugar. So in part, it's working by drawing out excess fluid. Too much fluid's going to inhibit wound healing. Number 2, it's a great antibacterial. It'll kill some of the surface bacteria and it'll prevent additional bacterial growth. The sugar is acting like an antibiotic. And then the third big benefit, it promotes a thing called epithelialization in terms of it's promoting those skin cells to grow over top of that open wound. So then you get a healed wound. See how I've got this cut in the corner of my thumb? Sugar could actually speed healing. So number 1, you're just going to fully clean that area using some type of topical antiseptic, Hibitane, or even just tea. Your little bit of sugar, you're going to evenly spread that over top of your wound. Kind of like putting, jeepers, sugar on top of your Rice Krispies. Then after that, you're putting on a Telfa or a non-stick pad over top because you don't want to remove the healing tissue, right? Because if you put on something that sticks, where it sticks to the healing stuff, you're just going to pull away all the healthy healing tissue. After that, follow that up with a bandage. Doing that a minimum of once a day. I saw a number of different animals in veterinary practice have much rapid wound healing because of this, sugaring, following up with appropriate bandaging. Number 4, this really important mineral, we seem to have forgot a lot about it. This is magnesium. A lot of people use it. We soak in it, magnesium salts, which makes our sore muscles less sore. We use it orally. It's great for sleep, great for muscle cramps. But it's not been used a lot in veterinary medicine, although historically it was used a ton. Say your pet jumped off a high shelf and say one part of their leg is slightly swollen, a little bit painful. It would be fine to try topical magnesium in that instance, right? This topical magnesium solution is a great option. You're just putting it 2 to 3 drops over top of that affected area, especially on the inside, getting through the fur. Do that twice a day. There are many people that have really painful hand cramps. They think they have arthritis in their hands, their fingers. They're finding even topical magnesium solution is really helping. Studies have shown that there's increased seizure frequency, then there's lower than adequate levels of magnesium. A dog like Tula that has anxiety. A simple, inexpensive, easy way to start: magnesium supplementation. The form of magnesium I would suggest is this. It's magnesium glycinate. It's a form that can be absorbed. It's bioavailable, but it causes less stomach upset. Doses of 1 to 2 milligrams per pound of body weight. I start with once daily before you go to twice daily. Number 5, for dogs in pain, dogs that have hot spots, ASA, acetylsalicylic acid, or aspirin. We used to have so many clients using aspirin, and when I first started out in practice, it was one of the few things we would suggest if a dog was ever in pain. The thing with aspirin, it was reasonably safe when given an appropriate dose, and it didn't cost very much, right? So you could actually help relieve pain in your dog without coming in and seeing the vet. But that being said, it doesn't have as wide a safety margin as many of the new NSAIDs, and ideally you're just using it for short-term use, like when something crops up. And if your dog is on an other anti-inflammatory, you can't use aspirin as well, or they're on something else like prednisone, then you're not using it. But for short-term pain relief, I've used it. But just don't discount it for short-term pain relief. Typical dog dose, 325 milligram tablet per 40 pounds of body weight, twice daily. The uncoated, the non-plastic aspirin is better in terms of it's then better absorbed to be effective. The other condition I want to mention is if you ever have a dog that has a hot spot, your dog has an allergy, they have a local area where they've started to really scratch, the surface of the skin is oozy, wet, red, and inflamed. One really effective hot spot remedy is you make a strong cup of black tea, you dissolve in 1 regular strength aspirin, make sure it's fully dissolved, and then you're wiping that over top of that hot spot 4 times a day, somewhere between 3 to 5 days. The black tea does a great job being astringent, drawing all that moisture. It's got some good antibacterial properties. And the aspirin, it is an awesome anti-inflammatory. It takes away all that inflammation. Your dog is far more comfortable in a short period of time. Number 6, an older and slightly forgotten antihistamine. This is Benadryl or diphenhydramine. It's a great option for your pet first aid kit. Say your dog has an acute allergic reaction. Maybe there's a whole extensive skin swelling. You might see hives. You can be using Benadryl. Perhaps you have a dog that has anxiety, they're trembling and shaking. Benadryl also has some mild sedating properties. It can help, especially in a short-term situation. Benadryl has been effectively used for animals that get motion sickness. They get sick traveling in the car. And it's even being used for mast cell tumors. Because what can happen is the mast cell tumors can degranulate, causing this whole systemic allergic reaction. So one of the big veterinary treatments is an antihistamine, such as this, Benadryl. The dog Benadryl dose is 1 milligram per pound of body weight twice daily. These are 50 milligram tablets. So a little 25-pound Tula should be getting half a tablet twice a day. Number 7, known as petroleum jelly Vaseline. It's a very inexpensive and simple product that can really do a lot. And in some situations, it is actually more helpful than a whole bunch of these expensive so-called natural remedies. Like Vaseline really can speed healing. Say your cat has been excessively grooming, maybe they have an underlying allergy, they've been hacking up hairballs or trying to hack up a hairball. The easiest thing that's going to speed removing that hairball, getting it to move through your cat's intestinal tract, none other than this, ta-da, the Vaseline. In fact, Vaseline, it's the active ingredient in most veterinary hairball remedies. A simple Vaseline dose, about a half a teaspoon per 10 pounds of body weight, twice daily. If your dog has a pad injury, especially pads that are dry, rough, or cracked, which we might see within the summer and the winter, especially when there's a lack of moisture, the single biggest thing that's going to cover, protect that pad, and speed healing, it's Vaseline. Applied a minimum twice a day, ideally you then follow up with bandaging. So the Vaseline makes a protective area over the pad and it keeps moisture in. And when the moisture is kept in, then the pad can heal properly. And that's what's speeding healing. More than anything else, it's keeping the moisture within the skin. Third big benefit I see from Vaseline is for wound healing. So see this little wound I have here. The big reason why it's having delayed healing is number 1, it's on a joint every time I bend my thumb. But number 2, it's pretty darn dry out here, right? There isn't a lot of moisture at all. So if I cover this at least twice a day with Vaseline, this wound, it will heal far quicker. And then if you look at all the so-called magic wound healing topicals are going to be in a pharmacy, the active ingredient in many of those, and actually in fact most of those, it's petroleum jelly, it's Vaseline. So the biggest thing is providing the right environment for that wound to heal. So it's not the topical thing that you're putting on, which is going to penetrate in through the skin and magically heal that wound. What you're trying to do is allow the body to heal itself. And by keeping the moisture in, that allows that to happen. So that's why this works so well. So yeah, it's kind of a forgotten remedy. We wrote these other new fancy jangled things. Inexpensive, ineffective, Vaseline. I wanted to give you a bonus remedy number 8. So it's not actually a thing you're going to give orally or you're going to put on topically. It's a type of treatment. Yes, it's a veterinary treatment, but it's one that you can all do at home. This is SubQ fluids. So you have an animal that hasn't been eating for a few days. They've been drinking enough fluids for a few days. They're probably clinically dehydrated and they're really deficient in electrolytes. This is one of the best ways to restore their fluids, restore their electrolytes. And it does such a great job of having them feel better again. We used to use this so much in veterinary practice that it's not something we talk about anymore. Say you have a cat that has a urinary tract infection or urinary tract disease. Say you've repeatedly seen your veterinarian, they know there's no stones involved. What happens is there's inflammation within the bladder. Maybe it's related to stress, which can cause it, then causes them to strain. You see blood in the urine. One of the biggest treatments, which is really effective and works really fast, SubQ fluids. The fluids penetrate into the skin, they fill up into the bladder, so they flush all that bladder inflammatory cells out. And the second thing they do is when the bladder expands, they provide natural pain relief. Like, this alone is huge. I was talking to this one old school veterinarian and I asked him, like, here you are, you're stranded on a desert island. You can take one veterinary treatment with you. What would you take? This, SubQ fluids. Do not discount SubQ fluids of how effective they can be for any sick animal. SubQ fluids. So you're going to have your veterinarian show you what to do. It consists of an IV fluid bag. This is lactated ringers, kind of the most common type of fluid we usually give in practice. A drip set. This is a micro drip set with a needle attached. This is a 20 gauge needle. Get more fluid to go in faster. You have a wider gauge needle like an 18 gauge. So what you're doing, I'm going to show you what you do, not actually do it with Cassian. So if you've got your IV fluid bag up, you have your needle on the end of your line. You pop off the needle cover and typically we'll go in between the shoulder blades. You make a small pop just underneath the skin, right in here. So it just pops under the skin at about a 45-degree angle, pops in. Then you're going to turn on your drip set, which is here, you're going to see that fluid run out. Typically, for a cat, it'd be giving somewhere between 50 to 100 mils, usually sort of 50 at about one time. When it's upright, there's a little line on the bag so you can see the amount of fluid that's coming out. And 99% of animals, they tolerate this really well. So, there it is squirting out, right? It's a small amount of fluid coming out, not very fast. It's a really easy thing for you to learn how to do at home and give to your dog, give to your cat. So yes, I encourage you, if this interests you, learn how to do this. It's a simple thing to learn how to do. Do it with your dog, do it with your cat anytime they're sick. And it can really help them. It'll get you through a crisis. All right, kitty cat. Meow meow. If Cassie was sick, I might be doing this just once a day, right? Maybe twice a day if he was quite ill and I'm just worried about his fluid status along with his electrolyte status. But a lot of guys, I'd find we'd treat them to SubQ fluids, once in the morning, once in the evening, and the next day they really perked up. So often there's a really rapid response to this. So there they are, my top 7 with my bonus 8 forgotten veterinary remedies and treatments that I think you really should be aware of and should be reconsidering because they potentially can really help your animals. And thanks so much for watching this edition of Veterinary Secrets of the Forgotten Vet Remedies. Click up there to subscribe, hit the bell to sign up for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book.